Welcome to another episode of the Realist Lens for researchers who keep it real. When it comes to recovery, there's so much more going on than just treatment plans and clinical outcomes. Identity, community, creativity, they all play a part. And that's where things get really interesting. In this episode, we're exploring how the arts can support recovery in ways that other approaches might miss, and how realist research can help us understand why and how it works. What does it mean to use music, painting, or storytelling as part of healing? How do people living with chronic illness make sense of their experiences? And how do those experiences shape who they are? What mechanisms are triggered? We'll also talk about the power of lived experience, the role of visual methods in realist research, and how to keep our work grounded, accessible, and relevant. Joining me is a brilliant guest who brings together psychology, the arts, and realist thinking in a really thoughtful and creative way. And I'm really looking forward to this conversation with Louisa Peters. Louisa, good morning. How are you?
Morning. I'm fine, thank you. Thanks for having me on today.
No worries at all. Thank you very much for coming. And I know we've had a couple of conversations before going live as well about some of your work, and you have signposted me to some really interesting pieces of art that have come through realist thinking. And I am fascinated by it. And I'm fascinated by all the work and all the things that you're going to share with everyone. So I'm really looking forward to our conversation. Just before we get started, Luisa, would you mind just sharing a little bit more about yourself and your journey to realist so far, just so people can get a little bit of background?
Yeah, I suppose my journey and my research will make more sense starting before academia. I actually originally trained in musicology and I worked in the arts and community sector for about 10 years before I retrained in psychology and went into my PhD. So you can kind of see where the subject matter is coming from. In terms of engaging with realist methodology, I kind of stumbled across it talking to friends I have working in the mental health field, so like clinical psychologists who sort of work in that kind of way of thinking. And I'd never heard of critical realism before. So I started reading into it. And as you do in your PhD, considering the alternatives, and I don't know, it clicked with me, that understanding of the world. And I read a bit around Roy Basker's work, and he applied critical realism to the understanding of illness and chronic illness as having a real physical, empirically measurable facet, but how we experience that, or if we even experience it, is socially constructed. And that for me, like, made sense in what I was trying to look at, and hopefully will make sense as I talk about the research as well. So I came across it right at the beginning of my PhD and I've stuck with it ever since.
Amazing. Thank you so much, Luisa. And it is true that a lot of the time, you bump into it, you read an article and you go, oh, that's interesting. And then you continue, and then it's really hard to think differently. Once you think like a realist, I think it's quite hard to not think like a realist.
Yeah.
Um, and obviously, I guess that from that work as well, from Busca, then you also came across some of the realist evaluation and realist synthesis. And how did you come across that work as well?
So yes, this I was pointed in. One of my supervisors was actually Andrew Booth. So he really helped me through the journey, um, through my PhD, and helped me to understand like applying critical realism in using a scientific approach and doing a realist literature review. So yeah, I was really sort of, although I was the only person doing realist methodology in my department, in fact, the whole faculty, my supervisors were really great at signposting me towards support. And obviously, the PhD network, which I was a part of for a long time, was really supportive as well. And I engaged in a lot of the training and, reading all the Ramesses documents. So that's, I sort of taught myself around how to do it basically.
Doing all the right things, Luisa. And that is a list where basically all realists join and share ideas, share questions, challenges. And there's a lot of traction in there. And there's a lot of conversations that happen. And there's a very similar one in Mail called Realist PhD. And it's a very similar one when you have meetings, etc. So as you say, Luisa, there is plenty of support and community when it comes to the realist world. And particularly, having a very experienced supervisor like Andrew as well to help you through that process. So you bring in your your music and your arts background and community settings, your psychology, and you bring it together to do realist work, which is fascinating. All those three areas, the music and the arts, the psychology and the realist. So you go on to do some realist work. You go on to do some of that for your PhD and after as well. So I guess I'm curious to start with in the choice of the realist approach for you, and what have realist approaches helped you uncover about the role of community arts in mental health recovery that other approaches might miss? Because I guess with the 10 years that you were working before, when you hadn't come across the realist world, you would have done it in other ways that can also be useful in their own right. But then what is it about the realist approach that has helped you uncover some things within this journey of community arts in mental health recovery?
I suppose one of the reasons I was drawn to the approach as well was the type of question I could ask, and the type of knowledge, I suppose, that you can use. So, obviously, having worked in the arts and the community sector, the things that I was studying, I was involved with. So I had a like on the ground knowledge that it did work. Right. And when I came to academia, I had to go to the literature to, to explore that further. And what I actually found was, whilst there is loads of great research out there that supports the fact that the arts is, good for our health and well-being and our mental health, sometimes the evidence can be quite mixed. And that's used as a reason to kind of dismiss it as a valid approach. And also, it's quite lacking in serious mental illness and that kind of long-term chronic conditions. That evidence base was quite lacking as well. And I just thought it was really interesting. And it was, and I sort of noticed that a lot of the research was asking, does it work? And I was like, well, I kind of know that it does. And I wanted to ask why, and why is this research like so mixed? And that's where kind of realist research was really helpful, because I got to ask the how and the why, and uncover the specific contextual features of these programs, that means it's successful. So I think the realist approach allowed me to use that idea that Pawson has of a hunch. Like, I did have a hunch, and there was some data there, some evidence, but a bit mixed. So I think the realist approach allowed me to kind of ask that different question. And in doing so, the findings kind of revealed, again, basically the need to reframe this idea of recovery, especially in serious mental illness. Mild and moderate can be a bit different, because a recovery is a very medical term. And it implies an end point. It implies you're coming back to where you were before. And actually, for serious mental illness, it's a process. It can be like other chronic illnesses that you have to live with and manage through the rest of your life. And so, realist research was really good because I got to define outcomes as a process rather than a definitive end result. So my outcome was engaging with recovery processes, not they've improved so much, not that, people have got back to a certain point in their lives. It's just that they were engaging with personal recovery processes, and they could, the fact that these might not be intended either. So like unintended outcomes as well. So the realist approach really allowed me to be able to look at those kind of ways of framing an outcome, which I think other approaches and like RCTs are very definitive when we're looking at health interventions. And I think my findings kind of revealed two interesting things. One was that the context is possibly the only thing that we could exert real control over. So how we create a safe space within this program. There are specific kind of resources, mechanisms that we might be able to activate. But when it comes to a person's recovery journey, because it's so personal, so unique, you can't predict it necessarily. So it's how can you possibly measure it? And I think, and it's really complex. So I think they the kind of interesting findings is actually the context is maybe we should be focusing our attention on creating these safe spaces in the context rather than how people are feeling X amount of months later, because that is something we can encourage and provide opportunities for within these spaces, but we can't necessarily predict or control. So that was the interesting thing I think I found out of the research.
Some very interesting things, and I'm sure that there's many to speak about. And Lisa, you see, I really like how you're framing all this, because I think it's really important to demystify some of this more clinical ways of, or like black and white ways, all or nothing ways of seeing recovery and mental health and chronic illness, which sometimes can be the case, and how for many people it is a roller coaster rather than a linear journey. So I think it's really important that you share that and you mentioned that. And you've spoken a lot about the rationale based on what the research and the literature says, which is, of course, interesting, I guess, for any realist. When there is mixed evidence, it works, it doesn't work. I guess it's like, fruitful area of realist investigation. But around the community arts specifically, I just want to touch on that a little bit more, because I think it's such a interesting area, an interesting way of trying to help people. And then the community arts, from your own experience, you saw yourself that it worked. But is there anything else from that environment, from the community arts per se, that you think makes it a really interesting field towards realist thinking?
I suppose community arts and sort of community-based interventions are complex social interventions, which is what realist research is almost for, isn't it? Those sort of those socially embedded interventions, because community, when I talk about community, I'm talking very local. I looked at physical in-person community. I didn't look at online, but so it's very physically local in a specific environment. So I worked in big cities, but then there's the boroughs of the cities. So I was working in very specific environments, but those environments sit within those bigger cities and they sit within our country. And then also our cultural kind of layers as well, all coming into that, the impact of policy from healthcare systems, from the government, from arts funding, all these sort of streams. So again, that complexity of actually being able to create these spaces, these very sort of community grassroots kind of spaces, is challenging in itself and complex. And I think that's where realist approaches are really interesting, because yeah, you embrace all of that, you know, to understand it.
I love that. And that embracing of complexity is exactly where I was going to move next, Luisa, because I really like the layers, like a bit like an onion that you were explaining, right? You have the core, but actually there's so many things that go beyond that. And these things are not static, they're dynamic, they're relational, they adapt, they change. So it is interesting to hear more around those things. Particularly in your work, where you have navigated all these different areas of identity, chronic illness, recovery, mental health, very complex, very layered. And in your work, how have you navigated that? In your realist research, in your realist evaluations, how have you navigated the relationship between all these different complex layers of identity, illness, and recovery? Because of course, that is what makes it, a fruitful area of realist investigation. But at the same time, from a study perspective, to make it feasible, to make sure that we can do it, that can also be complex. So how have you done it personally within your own work?
I'm not going to lie. I think it was a really ambitious, big project. I think I did manage it, but when you're starting out, I didn't quite appreciate how big it was going to be. In terms of the nuts and bolts of actually managing the data and analysing it, for anyone who's new to realist approaches and doing their PhD, is an early career researcher, it was a lot of trial and error. It was a lot of trial and error, and it was very messy. And I actually wrote an article during my PhD about how I did my synthesis in the literature review, because there's no instruction manual, is there, about how to use realist logic to synthesize, your data. And I was looking at mixed methods data. So and I wrote this article because I kind of wanted to show that you can make your own way. And that's the great thing about it. I don't want realist research to be prescriptive. And that's not why I did the article. It's not all like, this is how you should do it. It was, look how you can make it up to suit the needs of your project. But also for PhD students, this is how you can evidence the process as well. Make it work for you. That was kind of like why I did that, because that's the difficult thing, I think, for when you're doing it as a PhD is you have to evidence everything, how you develop theories, like how do you synthesize this? Your examiners want to see that. So that's why I kind of wrote this article to kind of say, hey, like, this might not be the best way, but I made this up and I was able to evidence what I did. And as time went on, I tried all sorts of different things. So one of the big things I used is mapping for CMOs. And in my actual thesis, I used causal loop maps, which is used more like it's being used more in the health area, and it's being applied a little bit in realist research because it is a complexity approach. So that was really useful. I'm using more little diagrams in publications that are maybe a little bit more linear, so they're easy to read. But I'm a visual learner as well, so I drew some of my findings. I created models, had post-it notes on the floor, on big bits of paper, drawing links between things. So it was a messy process. By the end, towards the evaluation, where I was doing the analysis for the evaluation, I used template analysis to provide a bit more of a structure, and it was great because it provides a really clear audit trail of your theory development. So I really recommend template analysis. But the downside to it is it's quite a linear structure to look at. So it's quite, up and down and hierarchical. So there's pros and cons to it. Again, I suppose you have to adapt to what you need for your project, really. Trial and error is definitely the way for me.
Kind of really important here, which is that there's not one way to do realist. And actually, this complexity focused lens, there's various ways that you can make it work for your project. And there's two that you've mentioned that I'd love for you to explain in a little bit more detail, maybe for individuals who haven't heard of them before or that they're trying to use them. You mentioned the mapping and causal loop diagrams. Would you mind just sharing a little bit into what mapping is and what causal loop diagrams are and
Yeah.
why they help in your realist project?
So mapping, what I mean by mapping is kind of like a spider diagram kind of approach. What I did is I had all my contexts, mechanisms, and outcomes, and because it was so complex and interrelated. Like you said, like identity is a type of recovery process. So they're already interrelated. And then you can have an illness identity. So illness, identity, and recovery become really intertwined. So what I did is like with post-it notes or in PowerPoint document, I'd put all my CMOs and I'd be drawing links between them, referring back to the data. So what I was literally seeing in the data, I was then drawing those lines between them to see what the CMOs are. The way that helped me was I could see then maybe if there was a particular context or mechanism that seems to be linchpinning things going on. And that helped me to kind of focus my theory, maybe that maybe this was like a more key way of explaining the mechanism, and the things coming off it are the kind of nuance. You see what I mean? And that's kind of how I'm using mapping at the moment. So I have the sort of big kind of key overarching mechanism ideas, and then off of those are the kind of nuance of it, the different pathways that people could go down these mechanism routes. And I use the word mechanism pathway. So yeah, causal loop maps, they stem from a systems dynamics approach within business management. So kind of like totally different to health, but it's sort of segued into the health realm. And you see them around, I've seen them quite a bit in health research to try and capture that complexity and the aim of them is to try and identify cause and effect relationships. So I'm not in realist research, I'm possibly not looking for that, but I adapted it to look at the relationship between context, mechanism, and outcome rather than that cause and effect. And looking at where when your lines between factors sort of loop around, is this kind of, because sometimes in my research, the outcomes became context, and they're looping around or reinforcing each other. Is this loop encouraging engagement with a recovery process, or is it perhaps reducing some of the negative experiences, such as stigma? So that's kind of how I use the causal loop map to kind of identify what CMOs were doing and kind of how they were helping to engage in those processes. Does that make sense?
Yeah, no, thank you so much. Thank you for sharing those examples. I just think it's always useful to see what's out there and what tools can be utilized to really help us with this complexity and layered systems that we're engaging with, and like the ones that you're engaging with as well, of course. And I guess that all this thinking, all this mapping, all this causal loop diagrams, Luisa, you ended up with some mechanisms by the end of it of some sort. It'd be great to hear some of those mechanisms that you have found in your work for
Mhm.
people with chronic illness, mental health recovery. What are some of the key ones that have appeared?
Yeah, so like I mentioned with the mapping approach, I think that was really helpful for me to see where there were, like I said, these linchpin kind of mechanisms or contexts that seem to be really important to a lot of the other parts that I'd identified in the research. So I actually had three program theories, and I'm just going to talk about the second one, which focuses on the processes. So the context of the intervention is it the space feels creates a safe space for people. It's quite empowering. They can choose how they engage with a creative activity or with the group. So it's quite an empowering, safe space. So that's the context that they're coming from, sitting within a wider context of the lived experience. And again, that broader social context of perhaps a culture that doesn't look kindly on people with serious mental illness, or there's a lot of taboo around it. There's a lot of intersectional stigma, depending on your own personal situation. So it's kind of this space within potentially a lot of kind of other challenges. And from this space, I found four kind of, I call them mechanism pathways, but so these are my mechanisms. So the first one is engaging with creative activities develops coping strategies. Valued shared experiences fosters acceptance. Through coping and acceptance, you can overcome personal challenges. And through coping, acceptance, and overcoming challenges, there are opportunities for positive emotions. So you can kind of see that they're already interlinked as well.
Very interesting that link, as you say, kind of like a domino effect within that. That one, as you mentioned, probably that causal loop pathway that you have, and those pathways that there is. So really interesting to hear about around those mechanisms coming into play within the context that you've mentioned, of course. Did you find at all any areas where it didn't work?
Yeah, so the rival theories are definitely essential, really, to realist research, and when you're even presenting it in your thesis or in your an article. The rival theory for me, when I was looking at the data, were the occasions where my participants or the literature in my review were saying that it didn't work. And then I was like, okay, well, why didn't it work? And looking at the contextual features there, like you said, what mechanisms. So one example was one of my participants engaging in an arts-based activity in a clinical setting. So I included that. I looked at clinical settings, but there were a lot of restrictions within that context around what they could and couldn't do, how much support staff were able to give in terms of an arts-based thing. And basically what that led to was disengagement with the arts, not only within that space, but beyond, because there was a feeling of failure. So that was really an important rival theory, and rival kind of like, and looking at those CMOs to basically, in my context, identify that the setting had to be non-clinical. it had to be a non-clinical community setting. But I did include that in my data, um, to explore, am I right? Does clinical settings work? And that's what I came up with. Does that make sense?
Thanks, Lisa. Well, really interesting mechanisms, really interesting rival theories. So, what I'm hearing from you talking and sharing about your experiences and reading your work is that there is potential for the realist approach to be implemented or used within the arts-based world of chronic illness recovery and mental health recovery as well. So when it comes to adding these approaches in the research cycle or the different methods that you may use, visual methods or music or poetry, but for your work, working with lived experience in mental health, what are some of the methods or approaches that you've used that have been useful to unearth some of these mechanisms?
Yeah, so I used quite a few different qualitative approaches. So I did use photo elicitation as one thing. I used realist interviews as another. And then the approach I took is something I call an arts elicitation interview, similar to like a visual elicitation, but I used the word arts because I encompassed non-visual data as well. And so what I did is I asked participants to who were engaging in a community arts project. That's why they were being interviewed, to bring in or even create artworks around specific prompts. So, about their lived experiences, about their time the within the community arts setting, and we used those objects, those artifacts in the interview to discuss their experiences. And the reason this was really important is because of the nature of the topic. So, serious mental illness is very emotionally laden. And they were emotional interviews. They took quite a long time. We had to have pauses. We had to, there was a lot of safeguarding around them. Had to think about where we were conducting those interviews as well to make sure there was support there. I mean, I wasn't asking anything explicit, but I'm just aware of the nature of this topic. And what the arts did is it made it a really kind of a safe way to kind of explore those experiences for people. And particularly because some of it is really hard to articulate. And that's kind of the points of community arts and being able to express yourself, because you can't just look somebody in the eye and say how it feels or what's going on in your mind. It's really, really difficult. And so using the arts in the interviews allowed us to be able to talk about these things. But what I did is use the objects as pieces of data. So I analysed the artworks themselves, and I used sort of a type of visual, what's it called? Visual textual analysis. Again, I had to adapt it for the arts. And yeah, so I've got an example basically. I've got an example if you want me to show you. So I've got an example of a poem that one of my participants brought to their first interview, and we were exploring their experiences of what it's like to live with their serious mental illness. And he wrote poems throughout his whole experience from crisis to engaging with recovery. So I brought one along today, and it's coming out in a publication soon, so you can see it there as well. And it's called Darkest Night. And it reads, "Even in the darkest night, eternal spirits keep their promise to watch over us, even as we sleep. Cold and lonely troubled day, with its faded story, earthly passions eased away, lost in heaven's glory." So just a little short poem there from one of my participants. And the reason I wanted to bring this one in is when I was analysing his poetry, there was this kind of hope throughout the themes of it, of recovery, and this imagery of being watched over, and a spirituality. And the participant found it really hard to articulate this when we were discussing it. He said, "I knew there was something, healing somewhere." And that's all he could say on the matter. So instead of relying just on his words, I took his art as part of his self expression, as part of his expression of his experiences. And this led to unearthing that first mechanism I mentioned of engaging with creative activities develops coping strategies. So in this case, the coping strategy is self expression, being able to express what they're feeling in an artistic way because I can't physically say it. And it sounds odd with poetry because poetry is text based, but quite a few of my participants wrote poetry because they felt they couldn't verbally say it, things out loud. So using metaphor and creating story and these scenes was a way for them to express of how they're feeling. And I've got another poem that my participant wrote, and it was called For the Homeless. And he said, when I write about these things like homelessness and things like that, it gives you an example of where I thought I'd end up because I was so bad with my nerves and my drinking. So he was struggling. This is when he was really in a crisis state. And again, you can kind of see this hope. He's got fear that he's going to end up homeless, but he's got hope that through engaging with his creativity, he's able to engage with that hope recovery process because he's able to express himself. He's able to kind of explore his spiritual side of his personality, and that's kind of the nuance of that mechanism. Do you know what I mean? It sounds quite straightforward, but it's a very nuanced mechanism, and that's where I think the arts in this specific situation was really helpful to understand people's experiences.
That's fascinating, Lisa. Thank you so much for, first of all, for sharing that work and for sharing and to really bringing it to life with those examples. And I could just, whilst reading that, I could just start thinking already about some of the potential mechanisms. I think it gives you so many clues, into where to go, where to find those potential areas. What is it about their experience that's making them write this in this way, right? So fascinating. Thank you for sharing, and particularly for sharing some of the various methods and tools that you've used. One of them, of course, being poetry, but also all the others, which again links a little bit to what you said earlier around there's no one way of doing art projects with realists, and what works for your project, what's going to be useful and what's going to be feasible within the remit of the project. So thank you for sharing that because that was really powerful. You've spoken about so many things around your journey, around the mechanisms, around how you use mapping and other tools to help you deal with complexity. So there's so many useful things that can come across of this conversation. But I'm going to put you into test now, Louisa, because I'm going to ask you to pick your top 3 tips from everything that you've said, or maybe that you'd like to share today for individuals who may be thinking around their and the realist work, and they want to add an arts-based approach towards the realist research. What would be your top 3 tips for those individuals? They could be PhD students, early career researchers, realist researchers that are trying new approaches. So what would be your top 3 tips to engage with an arts-based approach in community mental health for realist work?
So my first one, which I've said already, was adapt to the needs of your project. I think especially in a PhD, it's tempting to try and find that playbook and follow the instructions. But I think in realist research, you really have to just adapt. I suppose my second tip, especially around arts-based methods, is really asking why you need to use this approach. Like, what is it you want to find out? I think there's a real temptation in the arts. There's a real temptation to use creative methods and arts-based methods for innovation, using creativity for creativity's sake, and it won't work. Basically, you're going to fall down. It was appropriate in this situation because of the nature of the topic, but it's not going to be useful in other situations. So don't just use an arts-based process because you think it will add innovation, add, some interest. Always ask, like, what is it I think this is going to achieve? Like, it's got to be appropriate. And my last tip, not to do with methods or anything, it was just take a break. Rest is absolutely key. And I think that's where I think in complexity, maybe it's just me, but I advocate for it. Rest. when I'm resting or I'm walking, everything is processing. And that's where I'm sure some of my best ideas came from when I was out on a walk. And I get my phone out and just dictate a quick theory or something into my phone and put it away, So please take a rest.
Number one, adapt to the needs of your project. Number two, be clear on the purpose and goal of why you're using art, ensure that it's appropriate. And number three, take a break. Very useful tips that you can probably put straight away into your project and start thinking about as you go through that. Luisa, it's been an absolute pleasure having you in the Realist Lens. Thank you so much for your knowledge, for sharing, for showing all the journey that you've been through and the journey that you're still going through as you're going through your realist work. I think we all are at some point. And for anyone listening, thank you so much for hearing and staying tuned to another episode of The Realist Lens. And I will see you very soon. Luisa, thank you so much.
Thank you.